Welcome back. Combating the high cost of health care. The average U.S. household spends nearly $5,000 on health care, according to the Bureau of Labor Statistics. One major expense is hospital care. My next guest is trying to change that. Joining us right now is the CEO of Medically Home, Rich Rakowski. Rich, good to see you this morning. Thanks so much for joining us.
Good morning.
Well, we love the subject of technology and health care and this marriage going on, but you've taken it a step further by doing what can be done in a hospital in a person's home. Explain your business.
Yeah, so we built the world's first scalable virtual hospital, taking care that was otherwise delivered in the hospital and actually bring it to the patient's home. For three types of patients: those that are frequently hospitalized, those that would otherwise be operated on in the hospital, need post-hospital care, and those that are going through clinical trials that have oncology needs.
And everything can be done that's done at a hospital right in your home?
About 20% of patients that are currently hospitalized can be done at home.
Is this covered by insurance, and particularly Medicare?
So Medicare and Medicaid have varying programs that are moving towards this, but at this time it's for commercial insurance and Medicare Advantage.
Yeah, it's a much more efficient way to deliver health care. So does this, do you incorporate a physician's visit or a health care provider's visit along with the use of technology?
So imagine a 30-day episode of care that's centralized, where the physicians and nurses are actually in a medical command center. Then imagine technology in the home that's actually monitoring the patient and allows you to communicate with the patient and the family. And now imagine all the services that are currently delivered in the hospital on wheels, going to the patient's home. All that's centralized, managed, and monitored with technology. So that's a virtual hospital, the Medically Home virtual hospital.
Right, and I assume that also you're incorporating testing and monitoring of different elements, such as, you know, you can do all kinds of screening at home now,
yes,
properly following the instructions.
So the basic idea is about 18 services are delivered to patients in the hospital. Those are now going to be put on wheels, go to the patient's home, then managed centrally with technology.
What about data sharing and the concern with that? You know, Amazon just last week announced how they're getting more into the medical field, and there's major concerns just given what we're seeing in the technology space.
Right. Well, we think there's a big role for big tech to play a role in getting data from patients and managing that. We think the big focus now is shifting to where the care is delivered, the site of care. About $800 billion of the $3.5 trillion healthcare system expense is just fixed costs from hospitals. So if you want to move and decentralize that, you need to think about where the care is delivered versus how much we pay for it or where we pay for it.
And if you want to get sick, go to a hospital. Right? I mean, no, I mean it. I mean, it's better not to be in the hospital if you can actually leave the hospital.
One of the most researched interventions in the world is hospital care at home. So falls, infection, sleeping, cognitive decline, all of those are benefited by being home for recovery. Even being with your pets helps you recover from acute illness better.
But the main argument is this hurts the profitability of hospitals, right? Is that true or false?
Actually false. So hospitals can build new virtual beds now. There's a big issue in the United States with supply and demand matching. So many markets have hospitals that are too full. Many markets have hospitals that are not full enough. In either case, the hospitals are struggling financially. So this idea is virtual beds expand the hospital's reach by creating beds in patients' homes rather than bricks and mortar beds.
Yeah, which is why we've seen so much consolidation in the hospital industry. Of course, they're all struggling. Technology making real moves into healthcare. Google, Amazon, they're using AI as a way, and I assume that you're using AI in some of the machinery. The Journal is highlighting an app which provides doctors to recommend patients their prescriptions and medical supplies through a website linking to Amazon. What do you think of that advancement?
We think there's a big role for data, a big role for distribution with the existing system. Our focus is on shifting the site of care to the home because that's where we believe patients need to be and want to be. And right now, the revolution in healthcare is trying to move the battlefield from healthcare cost to healthcare sites. So we think that the tech is supposed to service the providers of care as opposed to replace the providers of care.
But this doesn't remove the need for human beings, whether they're nurses, physicians, assistants, or even doctors in the home, because that's the one critical thing that you do get in the hospital, along with infections and, quite frankly, sometimes neglect, is at least sometimes you have somebody coming by. Say if you have cellulitis or a staph infection, you need somebody there to look at it and just see the improvement. So how do you, what kind of level of human care would someone need in the home with your service?
So we are monitoring the patient 24 hours a day, 7 days a week for a 30-day episode of care. We have technology in the home. We could see the patient. They see us. We're connected to their families as well. We're monitoring their vital status. We have services in the home every single day during their episode of care. So think about the the clinicians that visit maybe once a shift in the hospital actually being 24/7 available, a single care team.
But it's via remote, is what you're saying?
The centralization is the physicians and the nurses. Everything else comes to the home, directly to the home, including nurse practitioners.
And by the way, more and more in hospitals, doctors don't even show up. When they do rounds, it's not a doctor, and they try to hoodwink you into thinking that it's a doctor coming to see you, and then you have to ask, are you a doctor? And they're not. They might be a physician's assistant who just got out of college. So you really have to have to put the hammer down on the medical professionals to make sure that you're getting the right care and getting the right answers, because very often they are not paying attention.
That's a good point. Well, what's the difference in cost in terms of the hospital stay, getting all of those, benefits that you get there versus doing that and having those benefits at home?
So medically home, we've found that about the cost of our model of about 30 days episode of care saves 30% versus the current cost of care in hospitals and the care that follows. And you ask, how is that possible to move all that care to the home? And the answer is the fixed cost of the hospitals represent about 65% of the cost of care. So we're arbitraging out the fixed cost, more care over a longer period of time using the home as a site of care. That's the idea.
How many insurers, you said commercial insurers, have signed up?
We're now in 3 markets. We're with 5 different insurance companies.
Okay, 3.
And growing.
The big markets, like urban markets, city markets?
Yeah, urban markets.
Yeah, you would think that this trend would take off, that people want to be in their home if they can get the proper care.
Absolutely. And what you're also seeing is for the high-end customer, or the high-end patient, you're getting personalized service. There are facilities that are operational now here, say, in New York City, where you can go in, see a doctor on demand under any circumstances. That is urgent care for the high end. What technology enables you to do, of course, is to bring that kind of personalized, on-site types of health care to all Americans, and I think that's the goal, isn't it?
Yeah, the key is about 135 million Americans are either on Medicare or Medicaid today, and it's a big issue for taxpayers, a big issue for the national debt.
And they're going broke.
And it's a big, big issue with our budget. So the basic premise is we need to move that care to the home, make it able to be available for all the public payers, not just for commercial payers and Medicare.
And by the way, somebody with a compromised immune system, a cancer patient who's on chemotherapy, the last place that individual truly needs to be, unless they are critical, is in a hospital, because they're exposed to so many different diseases.
You should come work for us.
And bacteria.
That's what I said earlier. You want to get sick, go to a hospital.
Yeah,
that's what I was
referring to.
I've had personal experience with that in the last 6 months, and it's this cycle of where it's a never-ending cycle, and it's hard to stop if you have to keep going back to the hospital.
Most of our investors, customers, and partners have had a personal story, a personal experience like yours, and that's what's really driving the business right now.
And this business was born of a personal story of your own, from your father.
Yes, I lost my dad to some medical errors, yes.
Medical errors.
Yes.
Rich, thanks very much for sharing
Thank you so much. Nice meeting all of you.
And we appreciate it. We'll be looking at the developments here.
Great. Thank you.
Rich Rakowski there.